Hi, and welcome to your next class on lymphatics. All right, so up to this point, you've done awareness, you've done breathing, you've done your cranial sacral, you've done movement, and you've done activating of the cerebellum through sounds, smell, and percussion and movement of the joints. All right, so now here is where we're really going to start diving into the organ systems of the body and the vascular system of the body. So if you remember in your anatomy, you had three parts of the vascular system. You had the arteries, that moves oxygenated blood from the heart and lung systems to the rest of the body. You have your veins, which then take the deoxygenated blood and brings it back from the extremities of the body and brings it back up into the body through the portal vein and into the liver to then be brought back to the heart to be reoxygenized. And now you have the lymphatic system. The lymphatic system is a vascular system that goes in and out of the arteries and the veins, and every single organ, gland, tissue, and cell of the body, collecting all of the waste, all of the systems that need to be detoxified from heavy metals, bacterial, viral, fungal, mold, hormones, and dead tissue cells of the body. The lymphatic system is that system that cleans everything up, brings really strong, healthy immune function that's anti-inflammatory, anti-swelling, anti-redness, anti-tender to touch, anti-pain, freer range emotion and expression of the body. The lymphatic system is that system that does all of that movement for us. So we have been moving the energy through our breath. That's your diaphragm. That's also considered the great lymph pump of the body. So already you're moving the lymphatic system. You're moving waste out of your body. You're moving more energy and expressive nutrition into the body already. You're already moving the joints and getting the joints to become activated, to activate the brain, to move the body, to move energy, and to help the circulatory system, specifically the lymphatic system, to move that waste from the tissues into the three phases of detoxification that we'll tap into more about when we get into the organ systems. But today we're really going to talk about the lymph system. Now, here's a crude experiment that was done a long time ago. They took some rabbits and they injected their joints with a blue dye. Okay? Then they had other rabbits where they injected them as well. And they put these rabbits into two groups. Group A rabbits, they massaged and worked the joints and the lymph tissues every day for a period of time. The other group, they didn't touch. They just let them run on their circles. They let them just eat their food and just sit around and do nothing much of anything except what a rabbit does. And then after a period of time, they euthanized them all. Then they dissected them. This group over here, let's talk about this group. This group over here that didn't do anything, that had no therapy, they dissected the joints and they found all the ink in the joints and inside all the vascular supply above and below the joints and sometimes around other tissues of the body. However, the group that had the lymphatic therapy done to them, when they dissected them, they cut open the joints, there was no ink there. There was no ink in the vascular flow, and there wasn't anything. The ink was gone, so the body had taken it and moved it, did what it did with it, neutralized it, and got rid of it. So the rabbits that had the ink and then had the therapy, no ink. The group that didn't have the therapy, they had the ink still stuck in their joints. So what does that tell you? That this therapy is going to clean up your joints. This is going to clean up your muscular system. This is going to clean up the tissue, organ, glandular system from where these therapies are done, and it's going to clean up that body so your body has a greater detoxification ability to get rid of the waste from the air, from the food, and from the water, and from the environment that can be very polluted, specifically in your different areas of the world. You're going to have more pollutants. Different foods that you eat, different water and drinks that we eat are going to have more toxins in them than vital nutrition. But no matter what, your body has to get rid of this waste. So working on the lymphatic system itself is going to, like we see in the rabbit study, these systems being cleaned up with the body through these techniques. So we're going to work on all this. So at this point, you've been doing so much cool work getting the body activated, moving, freeing, and flowing, and expressive. So we're going to talk about the lymphatic areas of the body. It's all in your anatomy book, and it's all in your workbook for today's systems, just like it has been on all the other ones. So you can see where these are. We're going to work on some hand-on techniques, specifically rubbing. Rubbing is going to be, and maybe some kneading, but mostly rubbing of the areas. The percussion was doing some of it, but we're really going to be working on rubbing the parts of the body for these lymphatic channels. The next one, and I mentioned it earlier on in an earlier video about cold and hot therapy. Now, this isn't new. This is old technology, has been around for thousands of years, utilizing heat and cold baths and saunas and hot rooms and cold rooms and all this type of stuff from cultures and systems all around the world for thousands of years. And so we're going to take that knowledge and we're going to bring it into a tangible everyday practice. Now, here's the thing. You've already been doing all of this work, and there's times where it's like, I just don't have time to do all of this extra stuff. Even though I want to, I just don't seem to have the time to do all of this plus this. So here's the cool part. This lymphatic drainage technique can be done in the shower and can be done in your hot, cold plunge pools or saunas and steam rooms if you have them. So most of us take a shower every day. Perfect. This is the time to do the hot, cold therapy with the lymphatic, with your breathing, with your movement. Because trust me, when you're in cold water, you want to move a little bit and you want to be rubbing your body. So it's the perfect time to do the lymphatic work. So when it comes to the hot and cold, let's keep it simple. And everybody's going to be a little different, depends on where you're living, what you have access to, and things like that. If you don't have hot, cold abilities, don't worry about it. Just do these techniques. And when you can do hot and cold, go for it. If you can't do some hot and cold, but you have ice buckets, you can just put your hands and feet in the ice and get that. If you have a cold plunge bathtub or a side pool that you can do a plunge in, awesome. But we're just going to talk about the shower because most of us have a shower that you can get hot and cold water pretty easily and move through there. So, simple. You go into your hot shower for a couple minutes, get your breath work, find your movements, wake up in the morning because most of us take our shower in the morning. Wake up, and if you're taking your shower in the evening, it's a great time to be able to dump all that stress from your day. It's just, you're not just cleaning yourself off from the day, but you're dumping all the adrenaline, dumping all the cortisol, dumping all the stress hormone from the hot cold therapy And then your cool down therapies at the end of the day to go to bed, relax, cool. You wake up the next day like, wow, I feel more vibrant than I did the last time I did this. Cool. So you're going to go into your hot shower. You're going to wake up. Okay. Then you're going to turn your dial to cooler, to the point where it's cold enough that you say, yes, I'll do that. That feels okay. A little colder. That's enough. That's cold enough. I'm done. Okay, so you stay in that cold temperature. Now, in that cold temperature, get your front body, get your back body, get your side body, get your head, get your neck, get it cold. What's happening when you do hot water, your vessels dilate. The blood vessels open up. They become more expansive, more oxygen, more ability to detoxify is flowing through the system. When you go cold, the system contracts. You get a constriction of the blood vessels. And so you get a pump effect, and everything is flushed into the portal system, back up into the liver to go through the 3 phases of detoxification. Then you do hot again, and your blood vessels will dilate a little bit more, and you'll have more oxygen and more nutrition flowing through your body. And then you go cooler. Maybe the same one, but test it out. Go cooler. I guarantee you'll be like, wow, I could go a little colder. That's awesome. Man, this is cold. Okay, I'm doing it. Get wet. And let the system then constrict, and it'll constrict a little bit more, pushing more out from the last time. So it's even cleaner than the previous. It's like going over your table with, like, you get all the junk with your cloth. Okay, now the next one you spray it down, you clean it, and then the next one you're gonna polish it. It's the same concept. Hot, cold, hot, cold, hot, cold. The first time was like the dirt. The second one was like the spray. The third one's like the polish. The fourth one's like arranging everything and making it look really nice. And the more you do this, the more dilated and nutritionalized your body gets. And the more you go cold and the longer, the more constrictive and the flushing it becomes. So going back and forth between hot and cold, hot and colder, hot and coldest, staying there and doing that multiple times. Your 10 to 15 minute shower is not just cleansing, not just hygienic, but now beneficial for healing and cleaning up and expressing nutrition and full detoxification of the lymphatic channels. So that's your hot cold therapy. Now, when you're in the cold or in the hot, but mostly the cold, because it's in the cold that you want to do the most rubbing, because it's cold and you're like, oh my God, this is cold. So, and if you don't have the cold, these are the same locations we're going to do. So all your lymphatic channels are spaced within the skin and the connective tissue, into the muscle, into the joint, and into the interstitium where all the organs are and everything around the body. And so we're going to work on this area. Now, when you're doing lymphatic work, you don't need to dig into the body. It's the more superficial, meaning gentle, you work, the actual deeper into the system you get. But if you try to dig in, really, it doesn't work. You dig in deeper and your body just says, I'm not opening up those deep channels for you because you just pounded on me. So your body really loves superficial, quick, rubbing movements on the lymphatic channels to get the deepest effect into the body. All right? So when you're doing, so we're going to work on rubbing techniques. All right? So in your anatomy book, the only one that I didn't put in was the arms. So we're going to be working on the arms. So forearm, bicep, side, internal. Okay? The other one's the axillary, which you saw, which is then armpit down. I didn't do the arms in your book. So arm, right through here. That's your arm work, okay? Same thing. You'll see the legs on your script here, and you'll see the demonstration as well. All right, so we're going to start from the head down. So head, just getting the skin. See how the skin can move across the bone? And I got the skin moving. So you want that skin to move. And I like to just kind of just take it. It's the only one that's really not a rub. And I take the skin and I'm just kind of moving all around. You can even get around the eyes right here, but the most powerful is right here into the head. It really helps open up the brain, get the brain to be clean. And trust me, you want the brain to be as clean as possible, not just the joints, because it's the brain that brings everything into the system and receives everything as well. So the cleaner the brain channels are, the more healing and flow of energy can happen. So this forehead one is really powerful, okay? And I just come around and do this. And at any time during this video, pause and then just get used to that area. Then restart and I'll be already moving on to the next one, and now you're continuing to be caught up so you can make this video go at your own pace. So here's your forehead. Now the next one is the neck here. And so you're going to come behind the ear, mastoid process, and here's your lymphedal suture right underneath my ponytail here. Got your lymphedal suture here. You're just kind of coming up around. Again, this is one of the ones that's not so much of a rub, but more of a movement of tissue. And you're just getting that tissue and then coming behind the neck and just moving all the skin around the muscle. Again, you're not digging in. You're just going nicely superficial and just kind of just moving the tissue around and just getting the lymphatic system moving. So here's your forehead. And again, when you're doing this, this is most important when you're doing your lymphatic, is to do the breath work. Find your breathing, find your pace, find your rhythm. Now, you're sometimes going to be in cold water. So it's going to be like, oh my God, this is cold. Okay, I'm doing fine. Great. Keep that up. Okay, and then here's your neck. Okay, now the shoulder one, the interscapular, is really hard to do on yourself. I mean, there's only so much you can reach, right? So it's really challenging to do that. So I recommend when you're get the interscapular part, is if you have a partner and your partner's there for you, they're kind of just going like this on that interscapular back with your fingers, up and down, and on the interscapular on the back. Or you can, if you're by yourself, you're doing rotator cuff work, really opening up the shoulders as the cold water is pouring onto your back. And it's really opening up that lymphatic channel from the dilation and constriction of the hot and cold with your movement and your breath. The same thing goes along for the spinal canal one as well. You're going to be getting that with your flexion, extension, lateral bending, rotation, and translation work. But again, if you have a partner, they're just going up and down your spine. Up and down your spine, on your back, all the way from your tailbone or your ilium, all the way up into the neck reflex where you're unable to reach. But again, all of these movements will open up that lymphatic channel in that sense. So if you can't reach them, you don't have a partner, that's okay. You're going to be fine with that. So let's restart with this. So you have your head, you have your neck. The next one you're going to be doing is the chest. Okay, so you have your clavicles. So this bone right here, find that clavicle. You're right below the clavicle, right where it starts here into the lung channel, mid-nipple line, right in this little box here, right on that sternum, right into the pec muscles, not into the breast tissue for this one. And you're going up and down and into the lung and heart channels. This is really hitting the lung and heart channels with the lymphatic. And you're just going up and down. Find your breath. Find your breath. Find my normal. Find my reverse abdominal breath, whatever you choose, and get that moving. Okay? So really getting that. Again, 3 to 5 full breaths, 30 seconds per area is prescriptive. That's the best timing space. Okay? We did the arms, and now you're coming into the axillary. Now, the chest into the lung channel comes here onto this axillary. Okay? Now, the axillary area is directly linked to the spine at T1 down to L2. That is your sympathetic nervous system. That's the side of the system that helps you with stress, but is also your go. You're able to manifest and create things. It's the system that literally feeds every organ. So it's not a bad system. The sympathetic system's kind of gotten a bad rap because they talk about it as part of your stress response. Well, yeah, it is, but you want it to be really good. You want to be able to do something without feeling stressed. So if it's strong, it won't be as stressed as if it's weak and closed off. So here's your axillary, and again, fingertips or rubbing with the arm right into the armpit, right into the pec on the side of the breast tissue, right here, all the way through. Now, if you're female and male, you really want to get into that pec muscle right here and really get into that. Breast tissue massage is a little different, but for females, work on the breast, and I'll get to there in a second. So here's your axillary. Again, breath work or timing. Okay, and then other side. Breath work and getting into the armpit, all the way down the side of the lat, right to where the ribs are on the pec side, and getting into that area. Really cleaning up these lymphatic tissues. Cleaning that up here. And one thing that's not in your book, but we're going to go over it for females, is the female breast tissue. So you want to take your fingertips and kind of just go all the way around the areola and really just getting into the breast tissue, kind of massaging it and moving the tissue around. Again, not digging in, but just superficial, and get the lymphatic system cleaned up. This is good for when you're on your period, because this helps clean up what would have been the milk that was going to be of child's ability to feed if you got pregnant, but also in your cycle we get lymphatic congestion and all the different channels that can get congested and then become tender to touch, can become noduled and other things. So coming here to the pec, into the breast tissue, massaging it, getting underneath it, and kind of just moving that breast tissue around. And you'll feel it when you're doing your breath work. And I'm talking, so I'm not doing the breath work, but you should be. And when you pause the video and you're like, okay, I'm going to work on that pec muscle video, well, the video is paused. You're going to feel the breath. You're going to feel the lightness of the tissue. And you should feel that. You'll feel light. Be like, oh wow, there's a lightness to that. That's what you want. So here's your sternum, here's the pec, and then here's your axillary. Okay, so quick review: forehead, neck, scapular, spinal. Talked about those. We had the arms, the axillary, the chest, and the breast tissue. Okay, it's good for the guys to do too, because there's a lot of congestion in that as well, but mostly specifically females for definitely the breast tissue. Okay, next level is your epigastrum. The epigastrum holds on the left side spleen, pancreas, stomach in the middle. On the right side, you have gallbladder, first 12 inches of the small intestines, and liver. Okay, so those organs really get a lot of benefit from this. This is where movement is helpful with the move. So I have my hands kind of gliding around, or I can just go up and down that area, getting right here into that axillary side where I stopped. Spleen, pancreas, stomach, gallbladder, duodenum, and liver. All the way across and back on through. And I love to do spinal twist with this one because it's really opening up this, and I'm hitting a bunch of organs, 1, 2, 3, 4, 5, 6 organs all at one time, just by getting this rotation in throughout my body, really opening up that epigastrum. 3 to 5 breaths, 30 seconds prescriptive, or what you feel that you want to do. And you can go back up and down and feel it all around. Next one is your abdominal. So in the abdomen, we have the stomach, ascending transverse, descend colon, okay? And we want to work on that. So we're just going to get now we're not trying to affect the organs. That's next time. We're just getting the superficial lymphatic deep tissues at those levels, not working on the organ specific. Again, that's next videos, okay? So we're going to just go up and down and around. Around, get the sides, get up and down and all around. Get the sides, up and down, all around. Clockwise, counterclockwise, doesn't matter. We're working on lymphatic. Okay, up and down, all around. Get everything from the ilium to the belly button, pubic bone. You're getting this whole area. You already got the epigastrum, and you're getting this whole area right here. Okay, so side and belly. Okay, now we just did this. So we're going to turn around, and we're going to get the area here. This is an area called the spinal gallant area for movement of the spine. You get this activated when you're doing a lot of your translation and your lateral bending with rotations. You're really feeling it. And you already probably felt it, but you really feel it. So here's your waist. Here's your lower ribs. And so there's your lymphatic movement up and down, all the way around. There was that side, and when I came in front, so just get into the back here. You can lateral bend, you can translate around and rotate, and just really get this area here. The next one is your gluteal. So you got this gluteal reflex. So here is the spinal gallant, and you got this gluteal that comes across. And again, you want to get this, kind of hard with the shirt, you want to get this area all opened up here, feeling that lymphatic system opening up on the glutes, specifically the glute medius and the upper glutes here work with a lot of energy that comes into the pelvis. And this is where you're going to see the pelvic work. And like I said, it's all written in your book that each level lymphatic is working on the level of organ and spine. So you're going to feel that moving throughout the body. So I'm going to move this camera back a little bit. And we're going to dive into the lower extremity. So here's your pelvis, and your pelvic area goes into the inner thigh, and you got your cremasteric. So you got your cremasteric here on the inner thigh, up into the pelvis, and up around. So you got the glute in the back, and then you come up, and you're working on the inner pelvis here, and then down into the inner thigh, or the cremasteric reflex. Again, this is all genital urinary, lower pelvis, lower back, really getting that inner thigh and the pelvis moving through from the gluteal, from the spinal gallant, and from the front. You can see how they're all connected. Okay? Next one is the IT band. Goes from the ilium here down the side to your knee. Okay? You're going to go up and down this area. Now, a lot of therapists love to dig into this sucker, and it hurts. Why? Because the IT band is the actual channel that feeds the lymph. We get to more traditional Chinese medicine in other classes. We'll start seeing how that works, but you'll feel a lot of congestion sometimes in this channel. So don't dig into it too much, but just go back and forth between this on this IT band, up and down, all the way around. You can do both. You can do the cremasteric and the outer one all at the same time, just going back and forth and feeling this through. Connecting. You see, you can connect them once you start getting to specific areas. Okay? Then the last one that we're going to work on is the hamstring through the calf and into the foot. So you are here and you just get the hamstring back down here, bend over and get the calf, and then the underside of the foot, like that. So underside of the foot, calf, and then hamstring. Normally I'm standing and I'm just going all the way down to my ankles, calf, hamstrings, and then working my way back up. So, quick review. There we go. Quick review is you have your head, neck, interscapular, spine, arms, axillary, chest, epigastrum, abdominal, cremasteric, gluteal, pelvic, cremasteric, IT band, foot, calf, hamstring. All of those lymphatic channels will feed every level of the spine, connected to the craniosacral pump from below and above and in between, getting all of the muscular systems activated through movement, through percussion, and through breath work and your awareness. Feeling, connecting, and feeling and moving. Now, you've been doing this in a hot, cold shower. You're going to come out like, oh, wow. Okay, it's time to go do my day. I'm going to take charge of my day. I'm awakened. And this is probably before your coffee. So you're like, wow, do I even need my coffee today? You'll notice that. You're like, wow, I'm awake, I'm aware, and I'm active besides wanting something to drink, do I really need that substance that pushes adrenaline, that pushes things? Not so much. I only need like a half a cup today instead of 3. So your body will shift and change. And this wasn't that, the whole thing about coffee wasn't to say that coffee was bad, but what I'm saying is that when you get your body activated, your sleep patterns will improve. Your waking up will improve. And even if that's sluggish, get into that hot, cold shower, doing these therapeutics on yourself, you wake up. Well, what's the point of some of those drinks? Is to wake up, right? Well, if you're already awake, besides having a good drink, what's the point, right? I don't need that extra adrenaline or caffeinated push. Great. So your body just becomes smoother and more vibrant and more of everything that is possible. So have fun with this, enjoy it, pause, repeat, do the drill, learn the skill, go over your book, learn where they're at, get clarity of when you're doing this, what it's doing for you, and enjoy. And I'll see you next time.